IHS Towers is one of the largest independent owners, operators, and developers of shared telecommunications infrastructure in the world. With over 30,000 towers in 3 regions, 9 operating countries, and over 2 decades of insight, extensive operational talent, and strong relationships with stakeholders, IHS has undoubtedly established its leadership status in existing and new markets. IHS Nigeria Limited has undisputably enhanced her profound support to her critical stakeholders by unleashing carefully thought out and predictive corporate social responsibility activities targeted at improving the healthcare system in Nigeria. The health indicators in Nigeria are among the worst, with the World Health Organization ranking her health system 187 out of 190 in the world. Nigeria shoulders 10% of the global disease burden, with infant mortality at 201 out of every 1,000 live births, maternal mortality at 576 out of every 100,000 live births, proportion per population of physicians and nurses or midwives at 39 for every 100,000 patients and 124 for every 100,000 patients respectively. It is obvious that Nigeria is not near the Cape of Good Hope as it pertains to halting her deplorable health indices.
We have a problem that is common to third world countries, where skilled laborers, especially in the healthcare sector, migrate away to get better pay elsewhere. If this issue has to be tackled, then we need to talk about the economy at large, because doctors alone would not be singled out of the whole system to be paid a better wage.
Adding to the grim figures aforementioned is the fact that Nigeria has the largest extreme poverty population in the world, with 86.9 million, nearly 50% of her population, living in extreme poverty.
A new report shows that 94 million people live in extreme poverty, with the country ranked as the poverty capital of the world. The latest data comes from the World Poverty Clock, which tracks poverty levels in real time. CGTN Samson Omale tells us how Nigerians are reacting to the news and their falling standard of living.
It affects my children also. It affects them so much that they went around picking things to sell. So you see that the government need to support the poor people, because our youth need a job. Honestly, our youth need a job. And we also, the mothers, need something to take care of our children. Children are not doing great because our government are not there for us. We, the poor people, we are the ones suffering.
It is estimated that at least 6 Nigerians slide into extreme poverty every minute. Nigeria therefore faces a large population boom that seems not to be urgently addressed. It is estimated that by 2050, Nigeria will become the 3rd largest country in the world, and her problem will definitely be unprecedented by then. Added to this is the fact that inequality has grossly increased and income distribution polarized. On the social protection angle, it is important to note that a large portion of Nigeria's population is clustered around the poverty line, making them highly vulnerable to shocks and falling into poverty. The shocks, which include diseases, death, theft, flooding, drought, etc., are known to occur more often among the poor than the national average. Under these circumstances, social protection has a critical role in reducing poverty and mitigating these shocks. Social safety nets, SSNs, therefore would provide an important consumption smoothing effect to prevent these households from falling further into poverty and to promote their ability to grow into sustainable livelihoods. The bad news is not yet over, as Nigeria's life expectancy has been hovering around 55.2 years, for the males 54.7 years, and for the females 55.7 years, giving it a ranking of 178 in the world. The leading causes of death in Nigeria are a combination of communicable and non-communicable diseases, both of which are substantially preventable, curable, treatable, and manageable. In the midst of this worrisome news, how is access to healthcare in Nigeria? Nigeria was poorly ranked in the recently released first Global Healthcare Access Report. The country was placed in the 140th position with 51 points on the report's Healthcare Access and Quality Index. The ranking is based on the quantification of personal access to healthcare and the quality of healthcare available in 195 countries from 1990 to 2015.
A lot of people are not able to scale the high walls of accessing healthcare. There's a geographical part of it which makes them not to be able to go to health facilities because it's far away from them. The economical aspect of it is that they can't pay for the health facility, the services there. So they keep away from those health facilities.
Upon realization of these depressing and worrisome statistics, Nigeria in 2018 adopted the Universal Health Coverage UHC, which is a healthcare system that provides healthcare and financial protection to all residents of the country. The strategic aim of universal health coverage is to ensure that everyone can use the essential health services they need without risk of financial ruin or impoverishment, no matter what their socio-economic situation is. There are largely two routes to universal health coverage: the single payer plan, where the federal government pays it all, or the multiple, where many stakeholders are involved with layers of insurance covers. In the midst of the gloom, IHS Nigeria introduced an innovative project which provided healthcare services on a mobile platform to break the barriers and high walls that prevented the populace from accessing healthcare services. The project, called PWOW, Project Wellness on Wheels, was one in which the full complement of medical services, health promotion, prevention, treatment, rehabilitation, and palliative care were taken to rural communities with little or no access to health care. IHS supported the piloting and scaling up of the highly successful Project Wellness on Wheels in 2 communities of all the states of Nigeria, including the Federal Capital Territory. IHS found an efficient implementer of this highly successful project in Community Health Empowerment Foundation (CHEF), a non-governmental organization which delivers impactful value-for-money community developmental and health interventions. Following the onslaught of the pandemic on the health, social, and economic systems of the world, Project Wellness on Wheels (PWOW) metamorphosed and emerged as Project Clinic Without Walls (PCWOW), which sought to provide answers to the emerging needs of the systems. Project Clinic Without Walls not only rolled out with medical outreach systems, but also provided extended continuum of care through the trial of 24-hour call center, telehealth, and pro-poor health insurance arrangements. Project Clinic Without Walls, which is the brainchild of IHS Nigeria Limited, is currently being implemented by Community Health Empowerment Foundation (CHEF) and AXA Mantad, a member of the AXA Group and a leading provider of life and non-life insurance products and services.
The company that has made this program today possible is IHS.
Wannan kamfani ya samar da ko menene wannan abun nan ne da ban fuskanta bane ba.
IHS. Yes. This number wire, the towers that you see, they are the ones that maintain them. Now there are 2 companies that have come for implementation.
Akwai kamfani guda biyu yanzu wanda suka zo za su fara wannan abin.
Company CHEF CHEF, Chef,
Chef, wannan
is
kamfanin
for 1 day medical outreach program.
yawa shi wannan kamfani guda biyu yanzu akwai wannan chef ɗin da ya magana shi ya ɗauki nauyin zai ba da gudunmawa ta duk wanda ba shi da lafiya aka duba shi a bashi magani amma na kwana ɗaya shi wannan kamfani kenan yau kadai.
The second company is AXA Mansard. AXA Mansard. Their own is health insurance for people that register with them for 1 year.
Shi kuma ɗaya kamfanin shi kuma ya ɗauki nauyin wanda ya yi rijista da suna a cikin ku wanda aka ga larurukansu suna buƙatar kulawa na tsawon lokaci to shi kuma ya ɗau nauyi zai ba da kulawa har tsawon shekara guda za ku zai ba ku magani kyauta.
The full package of innovative Project Clinic Without Walls hinges on using the community-based medical outreaches as an entry point to introduce other promotive, preventive, curative, rehabilitative and palliative interventions. Ihs Nigeria Limited, working with Community Health Empowerment Foundation and AXA Mansard as implementers of the project Clinic Without Walls, are providing community-based mobile medical services, social mobilization, deworming programs, mass screening, malaria prevention services, water sanitation and hygiene, and point-of-use water treatment services. Telehealth, 24-hour call center and health insurance to extend the continuum of care for communities. It is noteworthy that Project Wellness on Wheels and the succeeding Project Clinic Without Walls have, as of today, treated nearly 14,000 persons with minor ailments, communicable, non-communicable, and chronic diseases, tested nearly 9,000 persons of malaria using rapid diagnostic test kits, provided insecticide-treated nets to prevent over 4,300 families and households from falling through the menace of malaria.
My name now Silver Lane. I'm from Akani here. I try well. I really try. I give us many things, net, medicine, I give us buckets, so many things, both sanitizer. So I try well. At least if say all the other this thing they do like this, I look at the diet for nothing like that. If others will continue like this, say me when I well done or say when I continue and make others look on ourselves when they do like that. So one of us will live well.
Availed at least 100 families with a point-of-use water treatment kit to keep them safe from water-related diseases, including cholera. Dewormed at least 3,500 persons within the 36 states of Nigeria, including the Federal Capital Territory, to reduce the burden and load of worm and helminth infestation, which not only oppress the nutritional status of those people, but also lead to anemias. At least 2 communities in 36 states of Nigeria, including the Federal Capital Territory, benefited from this project and received adequate and appropriate social mobilization to change their health-seeking behavior, reduce open defecation, improve safe handling of food and water, enhance nutritional practices, and connect to a health insurance system for a time-limited continuum of care. Beneficiary communities represented by their traditional and opinion leaders expressed profound gratitude to IHS for extending such magnitude of benevolence to them. Some of the activities that took place were the linkages to health facilities and a health insurance system, social mobilization to enhance healthy living, campaigns to reduce open defecation and introduce responsibility and communal accountability of the issues concerning water, sanitation and hygiene. Community Health Empowerment Foundation (CHEF) and the implementing team took several opportunities to demonstrate the use of the point-of-use water treatment kits, insecticide-treated nets, and other health interventions. There is no doubt that the innovation of using medical outreaches as an entry point towards the introduction of other health interventions has come to stay. There is no doubt that community and social mobilization as part of health interventions creatively introduces partnership and enhances ownership drive. There is no doubt that for health benefits of medical outreaches to be seen is hinged upon its attachment to the provision of the continuum of care. What is in doubt is the number of organizations and governments that would follow the trail of IHS model to further scale up universal health coverage in Nigeria. This doubt will need to be cleared very soon so that the vast populace of Nigerians who fall into poverty by the seconds will be provided a safety net that will cushion the effect of the economic recession and the pandemic. Meanwhile, much gratitude has been and is still being expressed to IHS for the innovative project, Project Clinic Without Walls. Keep keeping the walls down so that more and more people will access essential health care and live their lives without falling into poverty.
My name is Tosin Ajibowo. I'm the project manager for Community Health Empowerment Foundation, CHEF. CHEF is a non-government organization that focuses on e-library, mobile clinics, mobile outreach, mobile medical outreaches, installation and upgrade of secondary school laboratories, safe water systems for communities, amongst other things. Since 2016, IHS is a telecoms giant. They are the ones that manage the communication masts and towers that we see dotting the landscape. And since 2016, as part of their corporate social responsibility, they launched a program, a medical outreach program, tagged PWOW, that's Project Wellness on Wheels. IHS chooses or selects 2 communities for every state. And the first phase of Project WOW actually covered 36 states of the Federation, including FCT Abuja. I will commend IHS for this laudable feat that they have done in improving the health indices at the grassroots levels, especially for the less privileged, and then in hard-to-reach areas. One thing we've endeavored to do, CHEF is an implementing partner, while IHS Towers is the major donor for this medical outreach. The second phase of it kicked off this year with 4 states in particular in the Northwest, Northeast, Southwest, and Southeast, namely Gombe State, Jigawa State, Anambra State, and then Ogun State. This time around, the project is tagged Project Clinic Without Walls. And part of the deliverables is based on primary healthcare delivery services, preventive and curative. When we go out for such projects, we first go for advocacy to meet with the stakeholders, that's the decision makers, right from the state level to the local government level and then the community level. When we go for implementation, we go with a team of medical doctors, nurses, pharmacists, medical lab scientists. And within the local community, we equally engage the services of social mobilizers, town announcers, and at times we make use of them to partner with us to translate in the local lingo. When the outreach commences, we have community people come around, turn up, and then there's no age restriction. It's not gender-based, male and female, children, pregnant women, the elderly, the youths, everybody is all attended to. And it's a free medical services program where patients who come or community members who come don't pay anything, whether to register for the program, whether to be attended to, maybe consultation services. And then for those who are diagnosed, maybe with one sickness or ailment, they get free medications at no cost to them. Part of the take-homes from the communities has always been that the people are always grateful for this big feat that IHS has been doing since 2016. And there's always been that request for IHS to still come back to still put them on their schedule or timetable for revisits.
My name is Unebu Jacinta. I can tell you that without IHS, there is no Project WOW. I want to also use this opportunity to encourage other organizations out there to come on board. IHS has done their part, but we have other organizations out there that can do like IHS.